Hi, I hope you're having a lovely day. For anybody who doesn't know me, my name's Victoria. May is Lupus Awareness Month, so today I wanted to do a lupus awareness video. I was diagnosed with Systemic Lupus Erythematosus in 2013. It was one of my first diagnoses, so I feel like I know a lot more about it than some of my other diseases just because I've had it the longest. There are 4 types of lupus. I'm going to probably say them incorrectly. Spontaneous or discoid. Discoid's the word that I've always heard it. Discoid lupus erythematosus, which is lupus of the skin. Lupus nephritis, which involves mainly with lupus of the kidneys, which involves a lot of kidney inflammation. Drug-induced lupus, which can be a long-term side effect of a medication, so you can take a medicine, end up with drug-induced lupus, and suffer with it for your whole life. And then there's systemic lupus erythematosus, which is the type of lupus that this video is going to be about, and it's the type that's most commonly diagnosed and my type, like I said before. So I'm just going to talk about lupus and not really my lupus diagnosis, otherwise this video is going to be way too long for all that information. So if you want to know about my lupus story, just leave me a comment and I'll do a separate video. Lupus is known as the cruel mystery. Most people have heard of the illness before, but few know what it is, and even fewer understand it, and that's including medical professionals, actually. The way lupus presents itself is unique as our fingerprints. No two people have the same symptoms, or the same treatments, or the same complications. Its complexity confuses medical professionals. Researchers are working on formatting better testing, finding the cause of lupus, and developing better medication, but it takes a lot of time. Many aspects are highly controversial, such as the cause of lupus, and the diagnostic criteria is still controversial, unfortunately. So what is lupus? Lupus is an autoimmune disease which the immune system becomes overactive and confused. Those of us with lupus are being attacked by our immune systems. It attacks everything from joints to hair, to skin, to kidneys, to every organ and everything in between. In a healthy person, or somebody who doesn't have an autoimmune disorder, the immune system fights off bacteria and viruses, working endlessly to keep somebody healthy. But that's not the case with lupus. There are a wide variety of symptoms. I'm just going to read the symptoms from the Lupus Foundation. And there are others, so keep that in mind. Extreme fatigue, lupus headaches, which are different for most lupus patients than migraines. Most have both, to my knowledge. Painful or swollen joints, fever, anemia, swelling in feet, legs, hands, or around the eyes. Most times, swelling, if it is lupus, should be mirrored. If it's in the left side, it should be mirrored on the right. If it's on the right, it should be mirrored on the left. So usually, it should be on both sides. Otherwise, the cause could be lupus or it could be something else. Pain in the chest with deep breathing, which is usually from pleurisy, which is inflammation around the lungs, and the inflammation, the tissue can become filled with fluids, which then could need to be drained besides the inflammation. So pleurisy can become very complex and life-threatening. A butterfly-shaped rash across the cheeks and nose, which I covered mine with makeup today, so you can't see it, which is okay. Sun sensitivity or light sensitivity, which is certain types of light bulbs that we have problems with too, in addition to the sun, so you have to be careful with that. Hair loss, abnormal blood clotting, fingers turning white, blue, purple, which is called Raynaud's phenomenon. Mouth or nose ulcers. It is vital to point out that lupus is the great imitator. Many illnesses have symptoms like these. Another illness that comes to mind for me is Ehlers-Danlos syndrome, because I have that as well. So it can be tricky to figure out what illness it is, if it's lupus and something else, or really what's going on. The search for a diagnosis seems endless and hopeless at times. From my observation, when being diagnosed with any chronic illness, not just lupus, it takes a really long time to find the correct diagnosis. The more that I read people's stories who have chronic illness, watch even like mystery diagnosis, or Just listen to other stories on YouTube. Most people struggle to find good health care, and they struggle to find the correct diagnosis and to get the right treatment. So it's very complex, which it shouldn't be, but it is. Many factors play into this, like adequate testing, lack of knowledge in the medical field, bad doctors, illness not progressing enough, etc. With lupus, it could take anywhere from a few months to 5 to 10 years for an accurate diagnosis. Currently, there's not one test to say, yes, you have lupus, or nope, that's not it. There are some tests like a CBC, which is a complete blood count, antibodies to find out if your immune system's attacking the body, blood clotting test, complement test to see signs of inflammation, urine tests and biopsies to check like kidney issues, and other tests depending on what other organs are involved. Treatment varies from person to person because everything varies with lupus, including symptoms and everything else, so nothing's the same. I'm going to just give you an overview of the medications because if I go into all the alternative therapies, it's just going to be way too long. So, non-steroidal anti-inflammatories such as naproxen or over-the-counter stuff like Motrin and Tylenol, which if you have lupus, you're usually not just on that. Steroids such as prednisone, which if you have an autoimmune, you should know what prednisone is. Antimalarials like Plaquenil, immunosuppressants like methotrexate, biologics like Benlysta, low-dose chemotherapies, which can also fall under the category of biologic or immunosuppressant. So methotrexate is technically a chemotherapy and an immunosuppressant. Remicade is an example of a chemo that is a biologic. So they all have all these fancy classes. Lupus is systemic, meaning it affects every organ in the body. It rarely shows up alone. Between 70 and 90% of systemic lupus erythematosus patients have at least one overlapping disease. Many have overlapping and secondary diseases that include but are not limited to Sjogren's syndrome, which I probably said that one wrong, rheumatoid arthritis, Raynaud's phenomenon, mixed connective tissue disorders such as fibromyalgia. A lot of people do have more than one overlapping illness. I don't know statistically how many. It was hard this time for me to find the statistics, even though I've seen them in the past. I don't remember where. So I'm just going to give you 6 additional facts about lupus that you might not know. The Lupus Foundation estimates that 1.5 million Americans and at least 5 million people worldwide have a form of lupus. 1 in 3 patients suffer from multiple autoimmune diseases, which is funny because I was told I was the only one with multiple autoimmune diseases. Not true. About 16,000 new cases are seen with lupus a year. More than half of them report seeing 4 or more different health providers with lupus symptoms before being accurately diagnosed. According to WebMD, 60% of chronic illness patients struggle with a mental health problem such as depression or anxiety. 73% of Americans between the ages of 18 to 34 have either not heard about lupus or know nothing about lupus beyond its name, which is a big problem. I hope you enjoyed this video, that you learned something new about lupus, and I hope that you'll share the video to help us raise awareness so that we can make lupus known and hopefully we can find a cure or better treatment or even just better diagnostic stuff at this point. I hope you have a fantastic day. Bye!